I just wanted to welcome you guys. We've got our lovely, lovely, lovely co-host today, Dr. Miriam Hanson from our North Austin location.
Hi, everybody.
I'm sure that most of you guys know about her, but she is a cosmetic legend. She is she is an extraordinaire in a variety of things, including general dermatology, but also injectables, injectable dermatology, Botox, dermal fillers, as well as being well versed in a variety of our rejuvenating laser procedures, which includes Ultherapy skin tightening. So I'm so excited that we have her here today to talk with us.
Thank you so much. I am excited to be here.
And then we have Misty Gray, the RN at our North Austin location, who is actually the practitioner who does the Ultherapy procedure. I'm sure that most of you guys know her as well. She is a cool sculpting guru. She knows, Ultherapy is one of her favorite procedures. So I know she's super excited to be here today to talk about it. But we are so excited to have you here to give your insight on the patient experience.
Well, thank you.
Let's see. One more quick thing before we get started. In order, I know that some of you guys may have to drop off because it is during the lunchtime. In order to lock in your promotion for this procedure, we are going to post the link in the chat box for you guys to go purchase a deposit from our online store. And what that does is signifies that you are intending to come in, get your consultation and treat. So you're locking in the event only pricing that is valid only through the end of the day tomorrow. So that's great. And then also by attending today, you're getting an additional $100 off of your Ultherapy treatment, which is amazing. So not only are you getting the best savings that we offer on this treatment, you're getting even more savings on it. So we're so excited. I'll put that in the chat box and we'll talk a little bit more about that towards the end. So Dr. Hanson, are you ready to get started?
I am. I'm excited.
Awesome. So let me go ahead. I'm going to share the screen and we're going to start the presentation and talk a little bit about Ultherapy and the technology behind it and how that will help skin tightening in various areas of the body. So let me get started here. Can we see my screen okay?
Yeah, thank you.
Perfect. So Dr. Hanson, do your thing.
All right. So today we're going to talk about Ultherapy, which is the gold standard for non-invasive lifting and skin tightening. I call it my collagen look. Let's go to the overview. So looking for a collagen boost. So collagen is a natural protein that the body creates. It works to give skin its youthfulness by keeping it firm and toned. As we age, collagen breaks down, resulting in a loss of skin strength and elasticity that leads to the visible signs of aging. So let's review the building blocks of the skin, and they include collagen, which is a protein lattice work that provides structure to the skin in its deep support structure. Elastin, which is a major contributor to the skin's resilience, helping the skin look firm, bounce back, and not sag. And hyaluronic acid, which is found in the dermis where collagen and elastin intersect, aiding in moisture retention and providing firmness. So what are the top skin aging factors? And these include sun exposure, lifestyle, stress, and then time. So what are the signs of skin aging? Well, there's underlying changes, which we reviewed a little bit, which include decline in collagen production, weakened collagen fibers, loss of elasticity, and then visible changes. So lines and wrinkles in the skin, cheek droop, eye hooding, sagging neck, and jowl formation. So you can see the progression over many years here with these photos of the natural kind of aging process. So we lift the skin by building collagen. Ultherapy is an FDA cleared to lift the skin of the neck, chin, and brow and improve the appearance of lines and wrinkle on the décolletage. So it starts with weakened collagen fibers. As our collagen fibers weaken and disappear, wrinkling and sagging develop in the skin. Ultherapy uses ultrasound energy to trigger your body's own natural regenerative response that stimulates the growth of new collagen and elastin. It tightens the skin in 3 months, and improvements can be continued to see over a 6-month period. So why choose Ultherapy? Because again, it's the gold standard for non-surgical lifting and skin tightening. It works by using ultrasound technology that enables planning, customization, and precise targeting of treatment areas. Again, it's a non-invasive, FDA-cleared procedure that goes deeper to lift the neck, chin, and brow and improve the lines and wrinkles on the upper chest. And it has a 95% patient satisfaction rate.
95?
Yes.
That's amazing.
So how do you tighten the skin without surgery? Ultherapy, that's how. So let's review how it works. So seeing beneath the skin, the Ultherapy difference, just like the ultrasounds that we use during pregnancy, Ultherapy uses first ultrasound imaging to non-invasively see beneath the skin surface. This allows us to map the facial structures, go deeper than other non-invasive treatments, and really pinpoint those collagen-rich areas that respond best to treatment and distinguishing those from those layers that won't. Really allows us to customize your treatment based on your unique anatomy of the skin. So see through the eyes of your provider. So this is what we see in the ultrasound imaging. This allows us to identify the depth and location, again, of the collagen-rich tissue in order to pinpoint exactly where we need to deliver the energy. By visualizing and mapping the skin, we can deliver the best treatment for you. Boost your collagen? Oh, right, science does. So how does it work? While lasers and radiofrequency can stimulate collagen production on the surface, Ultherapy ultrasound goes deeper than any other non-invasive treatment. It is FDA cleared again to lift the skin on the neck, under the chin and brow, and improve lines and wrinkles on the chest. It is a non-surgical option with no post-treatment requirements and no downtime. It has a well-established safety profile. It's customized for each patient and triggers the production of collagen and elastin that lasts up to a year or more. So in this visual, we see the different depths of a variety of different procedures. We see a surgical facelift that goes down to 4.5 millimeters. We see lasers that go down to 1.5 millimeters, which is much more superficial. We see radiofrequency that goes down to 3 millimeters. And then Ultherapy, which is micro-focused ultrasound thermal energy that goes down to a depth of 4.5 millimeters, the same as a surgical facelift. So jumpstart your body's collagen. Your customized treatment plan includes determining the right amount of energy at the right depth and the right temperature. Once your treatment begins, your provider will use micro-focused ultrasound energy to bypass the skin surface and keep it safe and deliver these tiny thermal points of energy. This will stimulate your body to begin the process of building new collagen elasticity, starting the day of your treatment. Now looking and noticeable results. Let your skin do the work. Some patients notice an immediate difference and results will continue to improve over 2 to 3 months. Most patients need one treatment, and because Ultherapy can improve skin laxity, you may be tailored to fit the needs of your aesthetic goals. So here we see patients with early laxity and advanced laxity. And you can see the results even after 210 days. So the results are definitely long lasting. So face and neck, let's review where we can use it. So these are the concerns that patients bring to us. They say, I have lines and wrinkles. I have eye hooding, jowl formation, sagging. So Ultherapy can treat areas around the brow, under the chin, and neck. It is FDA cleared in all of these areas. So here we see some before and afters. You can see visible improvement of the eyelid hooding and brow lift in all of these photos. The eyes look more open, more rested, and more awake.
Wow, and I think we have something fun to share with you guys. Dr. Hanson actually had this procedure done herself, and she's sharing her amazing before and after. So let me show that to you guys so you can see what results we've actually seen in our clinic.
So so I do a variety of different procedures. I do Botox around my eyes. I do filler under my eyes. I've had lasers to help with browns and reds. But the area that was really bothering me in the summertime in July was the under eye wrinkling. And so I had tried microneedling, which helped a little bit, but I was like, I'm going to try Ultherapy. So Misty, our nurse who's on the call, helped treat my under eyes. And this is from July, the first photo, and then October. So definitely an improvement. The results were slow. It takes a couple months, but I was like, when I saw the before and afters, I was like, wow, this looks amazing.
I mean, you can definitely tell, like in the area that's like right around your eye, the how the wrinkles have kind of minimized,
Yeah.
and how much more I feel like you look more rested.
Yes. So I really noticed on photos when I would see photos of myself, because before when I'd see photos, I just thought I always, felt like I looked tired. And so definitely I've seen a visible improvement.
Well, that's awesome. Thank you for. So we are talking about your treatment. So let's go into a little bit about how that experience was for you. So like, did you have to do anything before your treatment to like prepare for it?
No, there's no pre-treatment requirements, but they do recommend taking either 800 milligrams of ibuprofen or 1,000 milligrams of Tylenol before. There's also a cooling device that we provide to kind of cool the skin as we go along. But I came into the over lunchtime. Actually, I had it done, so it's a very quick procedure. And Misty treated. We did the 4 pictures. You signed consent, and then she did the treatment around my eyes. I think it took about 45 minutes. There was a little bit of signs of redness after, but essentially no downtime. The redness faded, I'd say, within a few hours, and a little bit of soreness the next day around my eyes. I've also done my neck area. That I did more recently, so I don't have the before and afters as well yet. But that was bothering me because a little bit of the skin laxity through here. And so definitely stay tuned. I'd love to share those results. I had that done in October. So I'll take my after photos in January. But yeah, essentially no downtime, went back to work, right after lunch.
I was about to say, did you go? I mean, we're talking here about results that they're saying are similar to the depth of what you would get if you were going under the knife or having a surgical procedure, and you literally just went straight back to seeing patients after clinic or after work or after lunch.
Yeah. So it was a quick procedure. When I did my neck, it took a little bit more time. So how it works is there's a certain number of lines that are applied to the skin. And so if you're doing a smaller area, it's going to be a quicker treatment. If there's more areas to treat, it may take. So I think when I did my lower face, neck, kind of submental area, it was about an hour of treatment.
That's awesome. And so, Misty, I wanted to ask you really quick, do you typically offer patients anything afterwards? Like, is there ice necessary, or is it literally just you take your things and you just keep going on with your day?
You typically just take your things and go on with your day. I do recommend people that have like high allergy type stuff, or if they get hives and stuff, to take a little Zyrtec or a Claritin before, just because that superficial skin that we treat, sometimes you'll get like a little hive like or a little bug bite reaction. And if you take a little allergy pill, it might reduce that or make it go down a little bit faster.
Oh,
but other than that, it's just gentle skincare, sunscreen, and you can put makeup on right away and go back to work.
Can we talk about how amazing it is that there's like nothing afterwards? That's so cool. I mean, I don't feel like very often you're able to do something and just like get back going. So that's awesome.
Well, there's mild redness, but that usually goes away within 45 minutes to an hour. But you can put makeup over the top.
Well, we're making changes where your body's producing that stimulating that collagen. We're doing all the fun stuff. Let's see. So can you see my screen? Are we back on the presentation?
Yeah.
Perfect.
We'll be reviewing some before and afters in the different areas. So under the chin, so here again, we see visible changes under the submental area. This is an area that patients have a hard time with. We have a variety of different procedures. We have cool sculpting that can treat this area. We have Kybella, and we also have Ultherapy. So the difference between the cool sculpting and the Kybella, which focuses on the submental fat pad that we have here, Ultherapy is really going to focus on lifting and tightening skin laxity. So patients always want to know what to do or what to do first. So if there's just a skin laxity piece, Ultherapy is your treatment of choice. Same with the jowls. The jowls is a tough area for patients. We do a variety of different treatment options. We do filler sometimes to tack back. We can apply filler kind of back here, but sometimes there's still just some laxity along the jawline. And so Ultherapy is a good complement to some of these other treatments to kind of tighten along this area.
I was going to ask about that. I definitely think that that's a great option. And I've said, I'm sure if you guys have been on multiple of these webinars, you know that I preach this endlessly, how important it is to go into your provider, your dermatologist, your esthetician, and talk to them about what your end goals are and what you're really wanting to work on, because there are multiple ways to get to the same place. And some of those include incorporating different things. And I know, Dr. Hanson, you said really well that maybe utilizing Ultherapy to complement maybe after doing a Kybella treatment to kind of assist with the tightening that you may not see from a fat removal process or cool sculpting. That I think it's a great idea to talk about what your end results are and compiling like the best treatment plan for you so you see optimal results. Let's see.
Yeah, absolutely. So here we see some photos of the neck area. So this is another tough area in our world because there's not a lot of treatment options for the neck as far as skin laxity. And so this is an area for a lot of patients it bothers them. And I would say from a texture and tightening perspective, that Ultherapy is the treatment of choice. Again, it's FDA approved, which is a big piece, and it definitely kind of helps this area, which is such a tough area to kind of treat. So you can see visible improvement along the neck, and then we're going to also show you along the chest. So this is the décolletage, is another area that over time, we talked about those reasons for skin aging, and sun plays a big role. And so for a lot of times it's, you know, it can be sun in this area. And so for patients that have a little bit more skin laxity, or it's just time, then it really, really helps improve those lines. So I think we're going to get to that in just a sec. Okay, we'll move one more. And so this is, yeah, the lines and wrinkles on the upper chest area. And so now we're going to show you, so it's a pretty remarkable improvement with Ultherapy in this area. The treatment day and beyond. So we went through a little bit with my treatment, but we'll go through a little bit more. So what do you expect? So like we said, we're going to have you, you would come in for a consultation first. We would just, you know, talk to you about which areas we're going to treat. We'd go through some of the pre-treatment instructions, such as the ibuprofen, antihistamine that we discussed, and then you'd come in for the procedure. So medical consent is completed, the skin is cleansed, and we'd always take before and after photos. Like I said before, if I didn't, you know, it's such a slow process because it takes a couple months for that collagen to reform. That's really important for you to kind of see those results with before and after photos. The treatment area is marked and the ultrasound gel is applied. Then we first use that imaging that we use again with pregnancy, but that's to really ensure proper placement of the handpiece and targeting the proper skin layers. Then we begin the treatment, which delivers the ultrasound energy in micro-focused pinpoint. The treatment again is usually completed in 30 to 90 minutes, depending on how many areas that we're treating. And then what to expect after. Again, we went through some of this, but essentially there's slight lifting, tightening, and plumping of the lines immediately. You get minor swelling, slight tingling, and tenderness to touch. Possibility of minor bruising or numbness and redness. 3 months after treatment, you get continued lifting and tightening, a tighter feel with smoother texture, and then even additional lifting and tightening, less sagging at 6 months after treatment. And then safety-wise, this procedure is so safe. It has been around for 11 years, and there's been over 350,000 treatments with no long-term adverse events. That being said, though, it's always important to go to a facility with trained professionals because in the wrong hands, obviously, you know, something could happen. But basically, there's essentially no downtime. The patient can return to normal activities immediately after. We just get a little bit of that flushing, which fades within a few hours. Some slight sort of swelling and tenderness, which usually goes away within 72 hours. And occasionally a little bit of temporary bruising or temporary numbness. So who should not do Ultherapy? Well, it's contraindicated for patients with open wounds or lesions, severe cystic acne, or active implants. It's recommended that some areas in the neck structure and around major vessels, breast tissue, or breast implants are avoided. It has not been evaluated in some patients on anticoagulant treatment, pregnant patients, children, those with certain disease states. And it's not recommended with certain directly over the areas with the following: implants, fillers, stents, breast implants, and again with scarring. Proven treatment, ready for a natural looking, long lasting lift without surgery. It's customizable. There's no pre or post treatment skincare requirements, and the results last for up to a year. So definitely schedule a therapy consultation today.
So I did have a question for Misty. So we talked a little bit about all of the different areas you can treat and kind of what to expect before and after you have your treatment. But Misty, what would you say like the most common areas that you treat on your patients are?
I would say the most common is probably the lower face, which is basically from, the side of your nose to your ear down, and then underneath the submentum. It just helps lift and tighten, and it also helps with texture and tone. It just does great. We have some people with that might have a little bit more laxity or in a little bit more advanced age, will notice a big difference in their texture and tone after a treatment.
That's awesome. And what would you say, do typically patients need more than one treatment, or is this more of a one and done, or give us a little more information about that?
Typically, I would say, you can do a one and done. If you have someone that at a little bit more advanced age, maybe in their 60s or their 70s, and they have a lot of laxity, I may recommend doing the treatment twice, doing it and then repeating it in about 3 to 4 months after we've done some pictures. Other people I do have that are like in their younger years, mid 30s, early 40s, where they come and do a treatment every year, 12 to 15 months, just to kind of maintain and feel like that they're holding father time off their face. They don't have necessarily wow effects, but it is preventing them from the collagen breaking down and not rebuilding at the normal rate, which happens about the time you're 30.
Awesome. And let's talk a little bit about, like, we talked about the different procedures that you could do and kind of pair with this procedure, which includes like cool sculpting or Kybella. You did mention something kind of about the texture and the tone of the skin. And although it does get improved because we are kind of affecting the collagen within the skin, would you say that keeping up a good skincare routine and making sure that you're maintaining the quality of your skin will kind of enhance the benefits of this procedure?
Absolutely. I mean, just good skincare and protecting your skin from the free radicals and the environment with sunscreen is going to do good things for your skin and help prevent aging all by itself. But then with Ultherapy, it does complement it.
Yeah, and I would say, Dr. Hanson, I mean, you could probably speak to this really well. I mean, people that don't take care of their skin by using sunscreen or being out in the sun a bunch. I know we obviously live in Texas, and I know Dr. Mammoth likes to joke about Texas chest and kind of how one of the main things that happens beyond the risk of skin cancer is rapid aging of the skin. Wouldn't you say that potentially could cause that, if you had Ultherapy and then went out and kind of damaged your skin, that could kind of counteract the benefits that you receive from the treatment?
Absolutely, yes. So just like we talked about again with the causes of skin aging, you're absolutely right. Once you've had the treatment, it's like good food for your body. Do you know what I'm saying? You want to maintain with those great skincare products, with sunscreen probably being the absolute most important, and then antioxidants, like Misty said, to neutralize free radicals.
Yeah, I definitely think that's a great idea. Like I said, I always insist that people, my friends, when they ask me about skincare, because I know I work in dermatology, I'm like, you have to go in and get a consultation, because I can tell you what I do for my skin, but it's different for every person. We want to make sure that it's it's customized to meet your skin's needs. I'm going to give people just another moment really quick to see if we have any more questions. And we talked about this a little bit. We talked a little bit about this, but there are basically no side effects to this treatment, correct, Dr. Hanson?
Correct. I mean, just the minor ones that we discussed that are short-lived and temporary. Again, it's essentially a no downtime procedure. So you don't need to take off any time from work. And it's a really simple procedure just to kind of block off time. You come in, you get it done, and then you're back to work or back to home.
I have a good question here. It's a fun one. Let's see. Is it effective on the forearms or your hands? That's a really great question.
So the areas that we discussed are the FDA cleared areas. Certainly we can evaluate tummies, hands, forearms, off, it's called off label, which means the FDA hasn't looked at it. It doesn't mean it's not safe in those areas, but generally when the FDA, they sort of focus on a few areas. So absolutely, it would just need to be the right, you need to come in for a consultation, and we want to look at those areas to make sure we feel like the treatment would be effective. Also, it's a larger area, so we want to make sure, again, that from a cost perspective, we're going to give you the best bang for your buck.
That's a great, yeah, I love that. Let's see here. And then let's talk a little bit about, if another question pops up, I'll definitely answer it, but I want to be respectful of everybody's time because I know we're kind of making this a little lunch thing. I do want to talk a bit about the promotion for this. So we are in the middle of our 2020 Beauty Expo, which I said, I'm so excited that you guys joined us today. We are doing this in lieu of our typical girls' night out or fall cosmetic event, just because we wanted to be respectful of social distancing, but we still wanted to be able to do this fun stuff that we look forward to doing all year round. I know Dr. Hanson was super excited about kind of being able to interact with patients again and talk about cosmetics, because this is like the fun stuff. So I did want to mention that we are offering 20% off of the procedures, depending on the area, and the pricing is going to depend on the area that you do. So if you have interest in learning more about pricing, I definitely suggest you schedule a consultation with Misty, because that's going to be the best way for you to get an accurate answer as to what to expect to pay. But like I said, if you want to lock in this amazing discounted pricing of 20% off your treatment package, you can purchase a deposit via the link that I posted in the chat. It was also offered in the email previous to this when the link was sent out for the webinar, and it will also go out afterwards just to remind you. So there's a couple of ways you can do that, and then you also get the additional $100 off of your procedure, which I think is a great like cherry on top. I do have another question. Generally, for the lower face area, what is the cost for before the promotional savings? Misty, do you have any information kind of surrounding of like what general price range that people can look at for that?
General price range around for lower face runs around $2,500.
I think that, yeah, I definitely think that's great. I mean, there's a lot of things you have to take into consideration here. The fact that this is a no downtime procedure is something that I think is like almost invaluable. I mean, I keep asking you about it because I've been off the fact that you're seeing the results that you're seeing, and it's so quickly done, and you're able to just leave and basically with a little bit of redness or pinkness of the skin and just go on about your day. I think that's phenomenal. And with the discount that we're offering right now, it's a great time. And I think kind of with the way things are going, with maybe not everyone getting together for the holidays, this is a great time to kind of give yourself a little TLC and do something for yourself. You know, self-care has been preached a whole bunch, and we've joked about a couple of different things, including like getting your lips done or taking advantage of the time we have at home where we're not necessarily in front of everybody to try out these things. And just when we come out of this looking more refreshed and just looking like a better you, and you can just say you've been at home, you know, just working out, living the best life.
So is that pricing pre-expo, or does that include the saving?
Oh, the pricing that I gave for the lower face, that was prior to the 20% off. So it'd be 25% or 20% off of that is the average. It could be a little bit more depending on if we needed to customize a little bit more for you, but the average is around $2,000 on sale.
That's awesome. Well, we want to thank you guys so much for joining us today. And I want to thank Dr. Hanson and Misty again for taking the time to talk with us. I think we've learned a lot of really interesting information about this, and I kind of want to go in. Misty, will you do my consult?
Yes, I will.
I love that.
Of course I will, Taylor.
I love that. I need that prejuvenation. I'm all about it. But thank you guys so much for coming again. Look out for that email after this. And feel free to shoot us any questions to events@sanovaderm.com. And I'm happy to pass those along to the providers. But I hope you guys have a great day. And we can't wait to see you back in the office.
All right. Thanks, everybody.
Thanks, guys.
Thank you so much.
All right. Bye.
Bye.